It's an absolute pleasure and honor to introduce our chief guest today. Before that, I'd like to just say a few words about LV Prasad Oration, which is inducted this year onwards. We are very, very thankful to the family, Dr. Ramesh Prasad and his family for this oration. And some of you have experienced, even now, some of the patients ask us, can I meet Dr. L.V. Prasad? So this is the regular thing. Those of you who do not know Mr. L.V. Prasad, I would like to say a few words. He is the most respected and successful film producer and the film director, for which he got the Dada Saheb Phalke Award way back in 1982. With the filmmaking, he made his studios, Prasad Studio in Chennai, and we also have one more next door. And there was a huge success of his movie, Ek Duje Ke Liye, made a huge revenue. And with that, he made an immense contribution. The LV Prasad Charitable Trust made an immense contribution along with 5 acres of land in the prime location of Banjara Hills. That's the genesis of LV Prasad Eye Institute you see today, and it's grown to 310 locations. Thank you very much to the LV Prasad family. We are very grateful. Second part, it's an absolute honor to introduce our chief guest today. Thank you, sir, for coming. It's your second visit this year. He has multidimensional. Sometimes, when you see a personality with multi-dimensions, we feel how people manage this. He has 4 dimensions and he has 4 decades of experience. I'm not revealing his age. He is an author. Many of you would have seen his columns. He picks up very, very important topics, relevant, and I would encourage every one of you to read that. And on the public policy, he is leading many things, governmental as well as non-governmental. You can see multiple quotes he has written there. And is also very, very experienced in leadership training, especially the senior leaders for the government and non-government bodies, and also always thinks of development. And if you see, in his early days, he is a physician by training. This is Bandipur tribal areas. This is where he is rooted. His first few years he spent in this area looking at, health, development, education of the community there. That transformed his physician to something else, which is inspired by Swami Vivekananda on the service as well as nation building. And this is his background. I have not taken everything, but something on foundation. It's a non-profit organization he founded in 1980s. It works on healthcare, education, livelihood, community empowerment, specifically on the tribal and rural populations. And he really worked for over 3 decades at the grassroots level. And he went to Harvard, and he's still a visiting professor at Cornell University. And he advised multiple state and central government bodies on governance, leadership, and rural development. As I said before, he has authored many books. I think Leadership Lessons for Daily Living is one of the very, very good one. I think we all should read. And he advocates development with a human face, emphasizing empathy, ethics, and inclusivity. These are his recognition, basically for his public administration reform, ethical leadership, and governance transformation. And his leadership lessons are basically taken from Bhagavad Gita, and which he transforms these lessons to the daily life today. His current roles, it's a huge role on, he's a member of Human Resources Capacity Building Commission of Govt of India, and also Chairperson of Social Stock Exchange Advisory Committee. This is a very interesting one, Social Stock Exchange. And as a part of Capacity Building Commission, that's the Mission Karma Yogi, he is creating the national initiative to reform civil services by building in India, capacity building. And he focuses on leadership, ethics, and human-centric governance. When I was reading, this is to sum up, just there is a lot of similarity between LV Prasad and him. He has an individual and LVP as an institute. We are celebrating 39th foundation today, and he has 40 years of experience. That's what I'm. And also, there is something very similar. Most of our work is at the grassroots level, secondary and vision center level. And he has worked in the past immensely at this level. There is an intersection of healthcare, education, community, capacity building, which is our part of our functional arm. And he really works on skill development. We also try to work as many people for skill development. As you can see here, people from Jharkhand, they come here, get trained on ophthalmic nursing assistants, and they become employed here and they become bread earners. You can also see ophthalmic technician program. So this is a real skill development, what we do here. I see a lot of similarity. And the last thing is, his name is Dr. R Balu, and we also have Balu. And both of them write immensely. So, as a role of doctor, social reformer, educator, and policymaker, Dr. Balu exemplifies the power of compassionate leadership with the belief that the quote, lasting change begins with individuals who care deeply and purposefully they act. This is very, very important. This is Dr. Balu for you. He is fondly called as Dr. Balu. Now I would like to call Dr. Balu on stage, and also Dr. Jian Rao and also Dr. Prashant Garg on the stage, and present the Oration Award to Dr. Balu.
Dr. Rao, members of the LVP family, members of the board, scientists, doctors, colleagues, and people in the other 309 locations across India. You know, the standard way we begin a lecture on this kind of an occasion would have been to say, I'm proud and honored. But I think that will be a very, very, I would say, not an adequate way of describing how I feel right now. What we saw and what is so difficult to even fathom is such an institution can actually exist in India. You know, as we march towards Vikasit Bharat, I think you're already possibly gone beyond that in a sense, and therefore there's so much the rest of the nation can learn. And for me, people like me, where I always thought, it was 1984 actually when I started the Vivekananda Youth Movement as a young medical student, and I can tell you my age, I was 19 at that time, so you can calculate now. When we first heard of the LV Prasad, no, we never, being in distant Karnataka in the forest of Bandipur National Park, for me it was just a hospital named after a very famous movie director, which meant that possibly his family started it. And therefore, coincidentally, the year I started the organization, also India's first large corporate hospital was born. Around the same time, first large software company was born. And coming from the background where I thought healthcare should not be commercialized, at 19, most of us are declared socialists. It needs a lot of time for us to get knocked on the head to understand that without capitalism, socialism can never flourish. And therefore, I was in that breed and living with tribals, one of the most exploited in this country, then and now. I was really troubled that, another hospital again, and somebody is out to make a lot of money from the eye care. And we thought eye care was something very precious and sacred. It took me a while, and many years later, Orbis, which is also supporting us for some point of time, invited us for a training. And I was blown away from the training that we got at LV Prasad. And I did come here, Dr. Rao. And I'll tell you the reason why I came here. Because for us, anniversaries like this are actually a reflection time for all of you also. I'm sure you will go back, and the way Dr. Prashant described it, I was wondering, is he really a doctor or is he a trained orator? It's so nice to hear how the pauses, the right gestures, and the right kind of words you mix. It was beautiful. And what inspired and impressed me was everything is so perfectly planned. Your professionalism is not just in your surgeries in ophthalmology. The way you started on time, the way everything ends on time. So I must keep track of my time too. And the compeers, I think, you're just brilliant. And I didn't know that I could be introduced this way, Dr. Ramesh. So thank you. I'm going to take those presentations because people mess it up. They go to the internet and then they don't understand ChatGPT can hallucinate very badly. And it gives all kinds of introductions, and when people read it out, you're embarrassed, whom are they describing, right? But you really brought it all together so nicely. So I know it's a time to look back, and with gratitude, with so many people who support this journey. I'm sure you're also looking around, 310 centers, so many employees, and you're humbled by, at least people like me are humbled by what you have done and accomplished. And most importantly, I know, and the way it was described by Dr. Prashant, you're looking forward, and the last two slides were simply, it demonstrated how you're also looking ahead with purpose, with renewed purpose, I would say, or possibly expanded purpose. I know that you have a center at Liberia, right? And so it's a huge opportunity. And I heard your fellows and how you're building a global talent pool, not just a national talent pool. I keep joking and telling that my role, people ask me, in a country where the nation's human resources were managed by the Department of Personnel and Training, and it was more a public administration where the ideas of human resources never heard. They asked me, what do you do? I said, I'm a glorified CHRO of Govt of India. And we have close to 2 crore employees, and we're struggling. I wish we could come here and learn from you. How have you worked this magic for 39 long years? So when you're joking about age and what you accomplished, and you're just 39 years young when you were talking about it, to me, a state which is close to nearly 80 years, which inherited the legacy of what all of us know as colonization, and an idea of being a subject of a crown to evolving as a citizen of a nation. This journey has been very, very complex and difficult. And I was sitting here and asking myself, I wish I could. Unfortunately, the reality of my life right now is time is something which I neither control nor is at my disposal. If I could just spend some time here and learn what was that magic pill that each of you have swallowed that could make this work so brilliantly well. And for me, all I could think of was a lot of people, when we started in 84 and I came here and went back, I understood the vision of this institution. And even then I was not convinced. Let me confess, full confession now. I went back and thought, oh, this man comes from America, and I have seen so many interns come from America, and they all say they want to serve India and they run away. And how long is this going to last? And we are all skeptical because that we don't know how to appreciate the good that we see around in the world. And I was no exception then. So I was trying to constantly tell myself, how can somebody talk of bringing the world's best eye care and say that I will give the same to the person who can pay some amount for it and also a person who can't just afford to pay for it? So how can somebody balance the books? I can't even run a small organization in the forest where tribals can't pay anything. And I thought I can get the non-tribals to pay. And even after 40 years, our hospital is still 60% in deficit. And I was wondering, how can this man make this happen? It can't. So it's just a fashion statement they're talking about, but it can't happen. But now, I must say, you're a legend, Dr. Rao. You're not just made it happen, but you are the model for what we can show that science, service, spirituality, and possibly the highest possible standards that you can set. Whenever we talk to the Honorable Prime Minister, he keeps us telling us these things whenever he travels abroad, we all worry because when he comes back, he'll have 10 instructions to give those of us who are working. And he says, repeats a lot of times to us, the 4S he says. He says, first, our problem in our country is we don't set standards. We see a problem, we just rush into solving them. And we don't even imagine it should be solved to the standard that we set. And that's what you've done. You just didn't rush into forming solution frameworks of people at vision challenges. You actually set standards which are global today. And then he says, the India's problem is so much that you can't say I'm a small little microcosm of excellence. Can you really do something which can transform the lives of 1.45 crore Indians? Otherwise, it's not a real solution that you can offer us. So he says scale. And what you've done is not just scale for India, but you're scaling for the world. And listening to your global fellows, it was just touching. That's the only word I can use. Touching beyond belief. But then he says, we all know we have to scale, but when we scale, what we lose is quality. It's dilution of a lot of standards that we do. But you can only preserve standards when you're scaling if you have proper systems in place. And I still remember even then, in the early 90s, I think, when we came here for training, I recognized that the kind of standards and SOPs that we were all trained for 3 days could not have happened just by sitting in rooms. Today, possibly ChatGPT would write it for us, but then those days, you had to really experience it, build on it, and then write something which will actually work. The context in which India operates is complex. You just started work in Bellary district. Bellary district itself is a different Karnataka than the rest of Karnataka. And how can you manage 4 different states with the complexities of politics, realities of the economy, the diversity of populations and their attitude towards healthcare itself, their disease patterns and their health-seeking behaviors being also complex, and you can manage to run it in 310 locations, shows that you have created systems which can be a lesson for all of us to learn from. I think it's not just ophthalmology. To just call you an eye institute, I think would be understating what LV Prasad is. I think you are possibly a model to set a health reforms agenda in this country, and we can learn so much. And he says, so when he says scale, standards, systems, what we don't understand is we need the people to run it, the staff. And they have to be trained to standards. And I was thinking to myself, the pattern that emerged from all your fellows was quality, excellence, and more importantly, 30 seconds later, the door will be closed. Because we think punctuality is just a discipline. I think these institutions are not built with discipline. Punctuality is a respect that you can show to everybody else in the room. It's a respect that you can show to your patients. And that is what is truly dignity in transactions. So what you have set up, my friends, is something unbelievable. Maybe when you're in the inside and close to action, you can't even recognize what you've done. Whether it's this conference room, whether it's your slide presentation, whether it's the introduction, whether it's the way you organize everything so beautifully. For me, my journey started off with several painful experiences. I'll only narrate one after I went into the tribal areas. Desperately wanting to be recognized as a physician. When you're 22, you think you're Albert Schweitzer and you're out there and the world needs you and they'll soon follow you with a Nobel Prize. What I recognized within three days of staying there was you're a nuisance. Tribals never needed you, they never wanted you, and they always looked at you with suspicion because they were the most exploited. 4 reservoirs built in the area where I went into in the first time. The entire forest being declared a national park but never having a legitimate status of a national park, but everything enforced as a national park. Everything that you can do when you take your people for granted. Our own countrymen, 8% of this country's population, living like second-rate citizens in this great country of ours. Everything that can make you take to the gun. But for my faith in Gandhi and Vivekananda, possibly I might have also turned a different leaf. You wouldn't have invited me for a Foundation Day lecture. I'll stop there. But then nobody wanted me there. I was living in a small hut, and the tribals thought this guy is not past his medicine. Somehow they have this little whisper from the non-tribal communities, and they told them that he must have failed his final year. So 6 months later, we are told he can write the exam again. So for 6 months, he's going to be here. So tolerate him for 6 months. That's how my life began, being tolerated. But then this hunger, in medicine, they teach us what LV Prasad. They don't teach us what LV Prasad is teaching all of you. We actually aren't taught empathy. Let me be honest. We don't have role models we can learn it from. We are not really taught equity. These are just fashion statements in medical college, which is there in your P&SM textbook. We really are not taught to treat patients with respect. We see them as carriers of disease, which we have to solve problems and boost our egos further to believe that we have done a difference. We made a difference, and I was no different. I thought, here I am. I'm going to change this world, wave my magic wand, and everything will change. But nobody's coming to get the magic wand waved at, right? And it can be a great disappointment for a young doctor. And I topped my university and I walked into the forest. So people thought I'm crazy. So you needed some validation. And the best validation for a doctor is when you see a patient, right? That ego satisfaction you get. It's service is all later. But first things, I did a big thing. And here nobody's even coming to you to validate you. So I was desperately looking for somebody to fall sick. And one day, a chieftain, I still remember, he just passed away, Sani Madaya, elderly chieftain of the Kadukurba community, came to me and said, my daughter is in labor. And when he said daughter, you believe it's a woman. So I said, wow, somebody has come to you now. And I loved obstetrics as a student. I had some of the greatest obstetric professors then. So I thought I can show off and at least get this child delivered, and I'll be a hero now. The chieftain has come to call me. So I had to walk 3-4 kilometers into the forest, into that little hut in which that girl was. When I went there, I discovered she was a 14-year-old child. And my mind, I can be honest in confessing, and it's embarrassing to confess to such extraordinary people who believe seva is a way of life here, that for me, it was a joy that she was only 14 years old. I thought, wow, high-risk pregnancy. Now I can be the real hero. Not knowing that I couldn't manage a high-risk pregnancy. We believe all the stories that we are told in medical colleges, and if you get a distinction, you think you're actually good. It takes a lot of lessons learned later to know that you're just as ordinary as you can be. But this child, I thought I should deliver her. So it was around 6:30 in the evening, and we were in the place where it's a Project Tiger and Project Elephant area where I lived. So I didn't want to be an evening meal for some tiger, so I just came back home. And I remember my professor telling it'll take primary gravida 24 hours. No textbook description of a primary gravida's labor. I thought labor pain has just started. Tomorrow morning I'll come back. It was my safety I was more concerned about than the patient's safety. So I came back, and next morning I was walking towards that colony, and Puttamma, and who still is an elderly granny now, she was taking water from a tube well, and she asked me, where are you going so early? Because being largest elephant corridor of Asia, elephants would drink in the river bank and go back to the forest. So that is a path in which I had to walk. She said, don't go now, we might get trampled. Then I told her, no, I have to go deliver Madhi. Madhi was the child's name. And she laughed and said, you don't have to go, child was born last night. What a disappointment for me. I thought, why couldn't this child follow the textbook and wait another 6 hours more? I would have delivered and become a hero. Only chance at becoming a hero and getting accepted in this community is gone. But I should do something, because my professor had told, at least put some eye drops and put some gentian. Those days we actually had gentian violet. I don't know if people, even the younger doctors here, may not even know gentian violet. So put some gentian violet in the umbilical stump and some drops in the eyes. So I went, I stood outside the hut of that girl, and I could hear her inside. I could hear the whimpering of the baby too. So I kept telling that Madhi to come out and show me the baby, because in tribal communities, those days since I was new, I followed all the rules. I couldn't enter the house until the lady of the house said, come in. Standing outside asking her, can I come in and see the baby? She kept there's no answer at all. There's no response for 5 minutes. Imagine an ego-filled doctor who thought he's just lost an opportunity to prove himself. The anger, the tension, the stress in my face, and I said, finally, I shouted out and said, if you don't bring the baby out, I'm going to enter and take care of it anyway. And what she screamed and what she said, please don't come. I have nothing to wear. This is a young 14-year-old in 1987, 40 years post-independence, had one sari she had, and she delivered her own baby, put it to wash, and put it on the roof for it to dry. And until the sun came out, she couldn't wear anything else. My life changed that day, my friends. I said, as long as under Madi in this world or in this country today, my job is this. And that little hut became a hospital, a school, a college, and a whole lot of things followed. Today we have my children who gone up to doing medicine, veterinary science, PhDs in IITs and all these places. But that is not the story I wanted to share. I wanted to say what starts off as one vision of possibly, and I like that wonderful. I still haven't figured out the real meaning of that sentence. It's so. If I could have figured it out, we could build more LVP institutes. Because I think the secret is how does one man who believes in in a vision so strong lead a community of people who can subscribe to the same standards of quality, excellence, empathy, equity, and continue not just in the place where you originated, but around the world. I think the world needs to figure this out today. The kind of complex problems we're creating for ourselves, we need to discover solutions at least which we can imitate, like the LV Prasad Institute. So what you have done here is not just for healthcare, much, much more. And ophthalmic care was not something I could even think about till again another tribal taught me the lesson that if you don't talk about eye care, you really can't talk about the rest of what follows in the world of development. Because to me, there's a I had gone to a tribal colony. One little 7-year-old came running to me and said, "My grandmother wants to see you." And I was reasonably popular with the elderly people because they would give this ragi muddes, and we have a lot of bamboo rice there. So I thought, oh, another good meal now. But this elderly grandmother was sitting in a corner with a stick and sitting outside the house. And this boy led me to her, and she said, "I can't see." She just had cataract in both eyes. It was just cataract for me, but for her, she thought it's destiny. She thought God has now told I can't see, and I've not able to see. And what really made me feel bad was this is a solvable problem, and I was not even trained because I never understood ophthalmology. I just went to attend it because I have to tick a box. But then it had to be solved. So we reached out to organizations, inviting them to come and do it, but we knew that coming into the forest, nobody was willing those days. And we said we'll have to start it ourselves. We still do small little work, and we are not even a speck in the ocean called LV Prasad. So what I recognized that day was it was not just vision we gave back to that elderly tribal woman. We restored her dignity, we restored her livelihood capacity. She then immediately started taking care of the goats she had, or her son's goats. She felt useful. But more importantly, it validated the development philosophy that I strongly believe in. I believe development is not about the airports, the buildings, the ports, all that we are continuously building today. To me, development is a constant expansion of human capability. It's about expansion of this capability manifesting in broadening of our human and social capital. And in that one day, I realized that elderly lady just didn't get sight. She got back her human capital. And she got back the sense of belongingness to a family because she was suddenly useful to the family now, somebody to take care of the goats. Her social capital expanded back to what it was. She got back respect and dignity. Just imagine what you're doing. All the numbers you showed, I think numbers don't speak the truth. What your touching lives are is maybe 5x that numbers in terms of transforming the human and social capital of millions of people across the world. And so don't ever believe that you're only taking care of eyes. So to me, vision is not just about sight, right? It's very easy to say it's just about sight, but I think it's about foresight. What started 39 years ago is rolling out into something phenomenal. Because you're not just doing healthcare, the research, the innovations, I have one of the mandates also given to me a few months ago was look at how do you make, we have 22 All India Institute of Medical Sciences across the nation, each one with a differential standard of functioning. We are not able to get standards across the 22 aims that we have in this country. And you have set standards from your quaternary center here to the smallest village clinics that you run, the standards of care, the passion, the commitment of people, the delivery of results, and the way it functions, the professionalism that is evident everything you do. So we wanted to look at how do you make these hospital centers of citizen centricity. And as I was traveling, I realized that I came here for the last event on innovations. On that time, I've been very troubled that we have our IITs and IIMs producing enormous innovations in their own small way, in their own big way too, in some IITs. But none of our All India Institute of Medical Sciences, in so many years of its existence, have been producing innovations or creating any incubated setups. So I thought, I've taken Dr. Prashad's permission that we need to come here and learn. And so I'm going to ask some of our team members and some of our consultants are going to work on this and say, how do you make and steal unashamedly what you've done for the sake of this country and take and go? And then it suddenly occurred to me, why only innovations? We need to understand your secret of scales, standards, systems, and how do you solve for problems. And I know I should check my time. I've exceeded it. You should tell me, it's no problem, I know you. What can you do to me? You can't throw me out anyway. But I have to be the first one to follow your standard also, no? After asking for it. So I think you've not just had a model that you've created. It's a model that has essentially been replicated. And for me, I'm really, really proud, privileged, and I consider it a great learning experience that I could come here today. I still know I've only seen through a small little pinhole, what you showed me. But I would like to see the whole, and I'm hoping that I can actually, possibly maybe after I'm out of the government, I can come and spend 2-3 days and just learn, so-called this learning in. So before I conclude, I think I want to say what Dr. Rao has created is not just a hospital, not just a healthcare system, but I think it's created a community of conscience. The way you attract donors, the way you attract doctors, the way you attract young people. And for the young doctors here, don't come here to just learn how to hold a scalpel on the eye. I think you got to take back how to hold a window to society itself. And everything you go back and take back. If you can take back what you learned here beyond ophthalmology, that you, without learning also you will learn. It's so much in the air that will just soak in. Right? But then the other things that is not spoken, that's not stated, but that is lived. That lived experience, if you can transform not just the world of eye care, but healthcare itself. That's the transformation India needs, because we desperately need solutions for this country. And with AI, 3D printing, and all that we can think about, designer drugs and what all you can call it, our India's AI mission is just getting set up. I was just looking at it and said, one large global company can pay one person $100 million salary to be an AI engineer. I was asking myself, what has the world come to, right? But then I thought that one person's natural intelligence at least has got a price, $100 million. But then when I sometimes look back and I keep having this discussion with my very senior colleagues, for us, the amount of grants we give our IITs to work on the space of AI, we have a long way to go. But I think LV Prasad should craft a proposal for the national government where you should say that you're going to find solutions where you have the abundance of natural intelligence here. And you'll complement that with some artificial intelligence to find solutions for India's problems. And maybe once the AI mission launches its proposals and other things, you will be one of the first ones to reach out and see how best you can blend, because what you will bring is humanized intelligence. And without that, anything artificial is only artificial. Thank you.
ತುಂಬಾ ಧನ್ಯವಾದಗಳು ಬಾಲಸುಬ್ರಹ್ಮಣ್ಯ ಅವರೇ. ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್. So Dr. GNR would say that you're not a real doctor if you've not served in the remotest parts of the country. And I think you're a perfect example of a good doctor, and you just did not go there to heal people, but I think you went beyond and healed the entire ecosystem. So thanks for doing this for our country, and thank you so much.
Not only a master of deeds, but a magician with words also. You have made us feel proud of being a part of the hospital that Dr. Rao has set up, even if we are just a light bulb in the wall. And at the same time, you have made us feel responsible for what we are going to do next. And even if they were clearly words in prose, you have touched us like a song. Roots reminds me of those who have nurtured the structure and soul of LVPI, which essentially began as a journey of a single person, Dr. G.N. Rao. Perhaps the words which I'll speak now is most apt for this situation. मैं अकेला ही चला था जानिबे मंजिल मगर मैं अकेला ही चला था जानिबे मंजिल मगर लोग जुड़ते गए और कारवां बनता गया.
Even as a proud Hyderabadi who claims to know her Hindi, this one's a little too intense for me. It's beautiful, but it's intense. Can you simplify?
हैदराबादी में बोलते जी अपन अकेले ही चले थे स्टेशन जाने को बैगन ये भीड़ कहाँ से आ गई.